What is the largest organ? It's the skin. There are many skin-related disorders, and today we'll go over a very common skin condition. Acne affects 85% of the people in the US. It is known to occur with the hormonal changes during puberty, but it can persist well into the adult years. Today's topic will cover mild acne, mild to moderate, moderate to severe, along with some treatment options. Common causes are clogged pores and hair follicles due to excess oil production, cosmetics that aren't oil-free, pressure friction, touching the face, and dead skin cells. Also bacterial and hormonal due to excess androgens and menstruation. Let's go over mild acne first, known as comedones, or what you may commonly know them as blackheads and whiteheads. They're non-inflammatory and painless, caused by clogged pores due to the buildup of dead skin cells and sebum. It's important not to cleanse harshly, as that will strip the skin dry and make sebaceous glands overcompensate and produce more sebum. Also, it helps to wear makeup that is non-comedogenic and oil-free. Blackheads appear dark in color because the pores open, allowing for dead skin cells and sebum to oxidize, while whiteheads are closed pores. Whiteheads can get infected by bacteria that will then inflame it, turning it into moderate acne, which we will go over later, but first let's talk about treatment. Treatment can be done at home with these three key ingredients. Glycolic acid is the smallest alpha hydroxy acid, or AHA, and it is water soluble, meaning it will only work on the surface of the skin, the epidermis. Salicylic acid is a beta hydroxy acid, BHA. This molecule is fat soluble, so it goes deeper into the pores. It also has antimicrobial properties that can prevent bacterial agents that cause acne. Benzoyl peroxide is used widely in medicine. For acne, it clears pores from blockage. It also has antimicrobial properties. All three of these molecules are exfoliating because they disassociate lipids that are binding the sebum and dead skin cells. A meta-analysis by Elizabeth Seidler and Alexa Kimball found a salicylic acid-based cleanser and toner regimen, in addition with a 5% benzoyl peroxide solution, reduced the percentage of non-inflammatory lesions by about 43% in 2 to 4 weeks. Participants applied this regimen once or twice daily. However, it is important to note that this can increase skin irritation. If this makes the skin feel dry and increases redness, the combination should be discontinued. Moving on to mild to moderate acne. It is inflammatory and can cause slight pain. They stem from clogged pores, the comedones that we went over earlier, that have been infected by bacteria, or it can be due to hormonal changes. Papules are small red bumps that are elevated and form from a deeper layer of skin, the dermis. Don't pop papules. It will cause bleeding and spreading of the bacteria. Pustules, on the other hand, contain a white pus-filled center on the epidermis or beneath the dermis. These two can also be treated with salicylic acid and benzoyl peroxide, as they are both exfoliating and have antimicrobial properties. In addition to this, it can be treated with over-the-counter products containing retinoids. Retinoids are a derivative of vitamin A, shown to be effective in treating cutaneous disorders such as acne. They also enhance the effectivity of antibiotics, which a dermatologist may prescribe if unable to treat acne at home, and they're comedolytic agents. In other words, while they do not unclog the pores like the previous molecules did directly, it prevents the formation of comedones in the first place by promoting healthy skin renewal, a process called desquamation. A video by Walter John will show the process of skin regeneration.
The epithelial cells of the epidermis undergo keratinization. The cells at the basal layer, the layer which is attached to the basement membrane and the connective tissue beneath, are cuboidal, and they divide frequently, maybe once a day. Once a cell is pushed up from this basal layer, it only has about 2 weeks to live. During this time, it synthesizes a great deal of the protein keratin, which is the major protein in skin, hair, and nails. Once the cell begins to push upward through additional layers, the cell gradually dies. The nuclei and other organelles degenerate, and so the cell then becomes a dead bag of the protein keratin. The cells are firmly anchored to each other because of the junctions found between these epithelial cells. These cells will typically stay on the epidermis for an additional 2 weeks, and therefore the outermost layer of our skin is made of dead interlocked cells known as keratinocytes.
So as you can see, if the dead skin cells did not slaw off, it would cause buildup and clog the pores. Exfoliating helps with this process. Retinoids do not exfoliate, but they help with the pathway of differentiating skin cells. If acne is not being treated effectively at home with over-the-counter products, it's recommended to see a dermatologist, as they might prescribe stronger ingredients, antibiotics, or birth control if you're a female. Let's look at the acne that forms in the subcutaneous tissue, the tissue underneath the deepest layer of skin. Now we're going to look at moderate to severe acne. It is inflammatory and painful. As we saw earlier, it forms in the tissue below the skin, so over-the-counter products won't help. They can be due to bacteria or due to hormonal changes. Cysts are filled with pus, can be softer, and cause a local immune response and inflammation if they burst and spill the pus into their surroundings. Nodules may or may not be red, and they feel much harder. Either way, since they are forming underneath the skin, professional help is needed. Hormonal acne can be seen around the jaw area or the chin. With severe acne, professional help is required from a dermatologist. Some of the treatments that can be expected to be seen, if the underlying cause is bacterial, then the dermatologist will prescribe antibiotics that can be applied topically or ingested. If the underlying cause is hormonal, then they may suggest oral contraceptives to females who have too much androgens, also known as male hormones, which cause acne and excess sweating. Some office procedures that may be performed are steroid injections and topical corticosteroids directly to the cystic pimple. They flatten, shrink, and reduce inflammation. Drainage and extraction is professional pimple popping and does exactly what it sounds like. It's a sterile office procedure that prevents scarring and bacterial spreading when performed by a dermatologist. To finish off, some things we should avoid are oil-based products, because that will promote buildup and clog pores. Don't use alcohol-containing products because that dries out the skin and will make the sebaceous glands work harder, as will scrubbing and cleansing the skin harshly. And to avoid touching the face unnecessarily to prevent the spread of germs, dirt, and bacteria. And finally, do cleanse the skin once or twice daily. Help with the skin regeneration process by exfoliating periodically, and seek professional help when appropriate. Thank you.